most welcome. Welcome to Big Conversations with Ordinary People.
Thank you for having me. Man. It's a real pleasure.
Yeah, it's a pleasure. We are doing take two of this. And hopefully this time won't have any technical issues.
I guess we also we left the 2020 problems in 2020.
Yeah, that's true. That's true. We also ramped up some of the equipment now, so
Fantastic.
trying to get a clearer picture to the guys who are doing this. One of the things actually I was talking about before, some of the things that intrigued me was the conversation you had yesterday
Yeah.
on Twitter. Telling that history of in those short phrases. It seems like I don't know, like it seems like that is something that Twitter can do that I did not imagine before. You can actually tell a complete story that's not exhaustive to read. It's different from reading like an autobiography. Sometimes you're like, okay, let me get to the interesting part.
It's different writing it. I don't know what the experience is for people reading. I don't know. Is it easy to follow
for me, maybe also because I've known you before, so I can fill in the gaps. I don't know where the gaps were, but it seemed coherent,
Interesting.
And maybe that's actually a good place to start. What is the motivation all the way from you winning prizes, and how do you get this luck in the first place?
Well, I don't know if I'll call it luck, but I think for me it was always very clear that healthcare was not where it should be. Going to medical school, I realized there were a lot of gaps in healthcare that were unknown to me going into it, and I think it became a personal mission to figure out how we can make healthcare much more convenient, much more affordable, much better quality, and bring it back from the dark ages where everything ran on paper, nothing was digital, everything was unimaginative, and just transforming that for the patient, for the doctors, and everyone that is involved in that value chain. So. We started conceptualizing, and when I say we, it's just me bouncing ideas of some other colleagues at the time, and figuring out how we can use technology, how transformative technology could be to healthcare. Healthcare was the slowest adopter of technology overall, and technology already was showing signs that it was transforming other kinds of industries like finance, banking, etc. And we thought it could do the same for healthcare. Uganda at the time, there was an increasing adoption of mobile phones, smartphones, the internet, and also when you look at the behavior at the time of patients were already calling. Even today, patients will call up their doctors on their personal devices, seek free consultations, ask questions around their symptoms and prescriptions. It was already happening informally. So we needed to figure out, is there a way we could institutionalize this, scale it up, make it much more legitimate and organized, and use it as a means to provide personalized care. And that's pretty much how we started out.
I think that's quite clear. One of the things that intrigued me, and I'm referring to the conversation had on Twitter by the Red Notebook. I forget what their handle is, but if someone searches the Red Notebook, they can follow up with that conversation.
Yeah, Red Notebook chat.
Red Notebook chat. You mentioned how you participated in the hackathons, how you won one of the prizes, and maybe what I'm curious about is how does the product change from, the TMC, the Rocket Health, even the branding is changing. We'll get to that later. How does a Rocket Health we see now, the posters in Kiwatu, those giant billboards, how does it start from the startup that's going to compete for? Is it 50K? Is it 50K you got from a price before? Or is it
So what basically happened, I think the trigger for us actually getting to a point where we could start, building out the ideas was winning a startup competition that was pretty much structured like Donald Trump's Apprentice, where you have all these contestants, and week on week you're doing different kind of business tasks, and the winning group, moves over to the next stage, and losing group fires whoever made the team lose. And I went through that series and got to the very end of it, and managed to win $50,000 from Wari, which is now Airtel. They had an entrepreneurship fund, and that $50,000 that was won then is what actually started the Medical Concierge Group in 2012. I also had some other co-founders, get on board. They also put some skin in the game, and they had some unique sets of experiences and expertise, and that's pretty much how the company then started. So that's how we got our initial funding, but then also our initial funding eventually also ran out, 9 months down the road. And we still had our full-time jobs, so we were using our full-time jobs to finance the company. But then, of course, that also comes with all its kind of problems. And we also realized that a business model is not something that you figure out on day one. You can have all these ideas about how this business model is going to work, and then the market teaches you a lesson, and you have to go back to the drawing board constantly until you figure that out, and hoping that while you're doing that, you're also keeping the lights on.
Yeah. I see.
So yeah, that's how.
What is the
that
nature of the business, though? So you're able to run a sort of virtual hospital, but you're also doing your actual full time job. And the way it sounds, all the other guys, the other investors, also doing full time jobs. What is the nature of the business at that time, and who was actually getting the work done in the business?
Yeah, so the way the medical concierge started was by setting up a call center that was operational 24 hours a day, 7 days a week. And we staffed it with doctors. And these doctors would handle incoming calls from patients that wanted to have a consultation. So the doctor would be a qualified, licensed, and trained doctor, and we would have the doctor take the patient's history, try to identify if we can arrive at a diagnosis with just history alone, and provide a course of treatment. So they'll write a prescription for the patient, and the patient would go and buy the medicines at their nearby pharmacy. If the patient needed to do certain lab tests for us to confirm a diagnosis, previously we would recommend where they would go and get a lab test done and about how much it would cost. And when they get those results, we would help them interpret those results and then figure out a course of treatment thereafter. Over time, as that started to evolve, what happened was that we were able to now combine not just the consultations that we're doing ourselves, but we also were able to layer on a pharmacy service and a lab service that we now run. And we also added on a clinic for those patients that we needed to see physically. That is a point at which we now rebranded that entire set of service as Rocket Health. So right now, Rocket Health, you can call in, you can chat, you can video call a doctor. If you need your labs done, the sample will be picked up from your location at home, your office. We bring that into our labs. We run the test. The doctors get the results on a custom electronic medical record system that we built in-house. The doctor calls you back, explains your results. If you need a prescription, then our pharmacy is able to deliver that to you. So we run our own logistics network also on top of that will deliver these medicines to you. All of this run by lab technicians, pharmacy technicians. So you're dealing with medical professionals throughout this end-to-end process. If you need to be seen physically, we set up an appointment for you at the clinic. So there's zero waiting time. We know who you are. All your information is already in the system. We know what we need to get done. You walk in, 30 minutes, you're out. So it's a much more efficient system. There are no queues, there are no waiting times. You get reminders for your visit. It's really just about building healthcare that fits into your schedule and your lifestyle.
Yeah, I see. One of the services I use most frequently from Rocket Health is I do regular HIV tests.
Okay.
Yeah. And
That's good.
yeah, well,
Use protection.
Yeah, but one of the I know most of the time a doctor that responds to me is called a Pamela. So
Yes.
I don't know her full name, but every time she calls and before she gives me the result, which is always negative, that's the way every time she calls, she starts with this sort of melodramatic story, asking about my history, my reasons for asking for this test, and also the tone of her voice, and even at the street back herself before. The thing is, it's different when you're on the phone at home, right? And maybe you're with your girlfriend and you're receiving this, and it's just you in the home, and the doctor is telling you, this and this and this before the result is actually, delivered. It's those maybe 1 minute or 1.5 minutes
Of not knowing
of,
the actual result.
of like the results. My sort of feedback was, why don't you just give me the results, especially if they're negative.
Yeah.
Tell me the negative, and then proceed with that test.
Yeah.
And she tells me, this is sort of the standard way it's supposed to be delivered.
Exactly.
And yeah, so the question actually I'm going to here is, when it comes to conventionally, right, what sort of experience you'd expect going to hospital, and how doctors are supposed to deliver to you such experiences versus, when you're getting this virtually, that is, for example, you get your HIV results that were normally if you go to the hospital. But then on the phone, if she called me when I'm in a taxi or when I'm driving, I could have knocked the next border guy, within that 1 minute. I'm wondering, are there things you change because now the mode of delivery is different?
Yeah. I think what we try to do is to maintain the tenets of good clinical practice. So the good clinical practice that you would get in the hospital is the same that we'll try to deliver using virtual care. When it comes to certain results being sensitive, it's important that there is some phase of pre-counseling and then giving the result and then having a conversation after that. And I think, most of these standards came out of previous experiences with giving people the results straight up. And over time that has kind of also been aligned better for different tests, different results, and maybe a bit different with cancer treatment, cancer that basically there's a whole communication style that comes with giving a diagnosis or a test result. And normally, yes, there's what will happen verbally, and then there's, of course, the digital results that will come to you via email. And we've also learned that a lot of the doctors that were used to physical practice, were actually looking at the patient, had to almost get reoriented and retrained, and made that part of our quality assurance process to make sure that even all our new hires go through this retraining, reprogramming, optimizing for what we call website care versus bedside care. So I think we're getting to a point where doctors are getting better at it, and we're pretty confident with the doctors that we have right now, and we're continuously sharing insights and lessons with each other on how best to deliver some of these services.
Yeah, that's good. So one of the things that probably a week or two back, they shut down because of the election. Those what most people think was
you need to say what shut down.
The internet shut down. The internet shut down. And I think almost everyone expected that social media would be affected.
Yeah.
But pulling the plug on the actual internet,
Shocking.
Yeah, shocking. I thought for me it was a little bit reckless, and I'm wondering, for a person in health, what was the worst sort of case scenario that happened, and what is the worst case scenario that could have even happened because of this?
It's tough, right? It's extremely tough. A lot of services depend almost entirely on the internet, and pulling the plug on the entire internet can have no positive benefit other than selfish pursuit. In healthcare specifically, like a lot of people keep their medical records in the cloud. So you're in a situation where you almost can't even access a patient's past medical history, so that you can be able to provide an accurate, diagnosis or status on their health, or even pull their medical history in case you need to refill their prescription for one reason or another. That alone is just disruptive for a lot of healthcare providers. In that regard, I think we had taken several steps to make sure that we implement a lot of technologies to be self-sufficient, especially if they're critical technologies, and having them hosted locally, and also still relying on basic technologies also as part of our service delivery channels. So, for instance, somebody could still be able to call into our toll-free lines to access the service, use SMS to get a callback request, right? But then there are certain services that are completely disrupted. So, if you think about insurance as clients, insurance clients were not able to verify their identities, or we couldn't even look up their benefits and know if they're eligible to get a service. So all of that, had to happen, by sheer trust that, when the systems come back on, we'll see that you haven't consumed more than your insurance is allowed, right? And then also things like submission of insurance claims was, again, also impossible. Everything that was previously electronic had to be done on manual, paper-based forms, which of course becomes inefficient, requires extra administrative burden to reconcile all this information. We have an online e-shop at rockethealth.shop where people can, purchase doctor consultations, pharmacy items, lab tests, vaccinations online. Of course, that was completely inaccessible, so a lot of self-service clients couldn't get this information. Even tougher that this is happening in the middle of a COVID-19 pandemic. We couldn't receive electronic results of COVID-19 tests, right? All of that had to happen almost manually. You couldn't verify a COVID-19 result at the airport. So, even there working on trust, you could have had fake results and been able to fly. They couldn't verify that this information was from the accredited labs. So it's extremely disruptive in more ways I could probably list.
I see. I know when I was still working at MCD, for example, and even before that, I was familiar with the I think it was NOH policy that would require all health uh, data basically to be kept within the country. I don't know if that applied to Uganda, but I know countries like Rwanda, even up to now, you're not allowed to. I think Rwanda, Zambia, where I work right now, we also work within sort of the same field. And I know Rwanda, Zambia, and Mozambique, you can't, at least to mention but a few, you can't move data out of the country, health data. I mean, technically you can, but they sort of put those laws in order so
Yeah.
at least primarily,
Yeah.
or officially,
Yeah.
all your data is kept, all the health data is
Yeah.
kept for the citizens kept within the country. Uh, would this sort of, I know they did put it up to sort of predict that seven or switch off the internet, but did this help in any way?
So, well, fortunately, we do keep servers locally. So, all our critical information about our patients is secured locally by us, and we can control the security protocols around that. And then we have that backed up at an offsite location that we can also defer to that is also in country. It's also important to keep, an encrypted backup in the cloud because you also never know what may happen at any of these locations. And yet you may still want to, provide services to people. So I think there is need. I mean, for a country to have regulations like that, you need to have made investments in the local infrastructure, right? So if it's data centers, do you have accredited world-class data centers in country that will provide alternatives to international options like AWS and so on, right? Do you have the technical expertise in country to make sure that if there's a problem, you can get us back online, or we can have 99.9% uptime, right? It's one thing to demand these things, but if you haven't made the investments, then you're just building castles in the
Yeah,
sky.
I agree. I agree. I know a few years back, I used to see. I thought MTN was trying to make a deal with Microsoft to have an Azure data center in the country. I don't know how realistic that was
Yeah.
because again,
Well, now that we've shown that we can switch off the internet, I
yeah,
don't know
yeah,
if anybody would want to have a data
exactly,
center in this country.
exactly. Yeah, yeah. So yeah, but that's actually another big question. What does this mean for investment, right? Because your company is a tech company. Tech
Yeah.
right now is very synonymous with the internet, and
Exactly.
the fact that people know that this could be one thing, the election could be one thing, but the other thing is you could get an investor who just has beef with
Yeah.
one of the past children or something like that. How safe are investors? What does it signal to investment?
I think my concern, and I think the biggest risk, is not that it happened, but more so that we don't know when it could happen again. And that unpredictability and that uncertainty is what's most unsettling. That, with no warning, no notice, you could be back in the dark
Yeah,
ages.
I see, I see.
And investors make bets on as much information as they can possibly get about the future. The investor is betting on the future, and the better they can predict the future, the more confident they will feel about making certain investments. So we need to build investor confidence, and if we take actions that don't do that, we in turn hurt ourselves and the investment climate in the country.
I see, I see. Yeah, to move on a little bit to the pandemic, and again, I don't want to say the pandemic came as sort of a blessing in disguise for your company, but it is something very similar. I know you guys were still going strong before the pandemic, but the pandemic definitely sort of put you out there as the solution for such a scenario, right? And I want to sort of understand in terms of numbers, if you're comfortable
Yeah,
sharing any, what was Rocket Health and TMCG before the pandemic,
yeah.
and what does this mean? What does the pandemic also mean in terms of your business going forward?
So the COVID-19 pandemic was a huge boost to telemedicine, mainly because all healthcare encounters previously almost entirely happened within clinics and hospitals, and all these places are known for long queues, waiting rooms, people and patients congregating, doctors mixing with nurses, mixing with patients, mixing with sonographers, and what we call hospital-acquired infections. And of course, COVID being airborne, made this a hospital a high-risk area. So a lot of people, especially those that had chronic conditions, were elderly, just couldn't go to the hospital, didn't even want to go to the hospital. Then also on top of that, add lockdowns, mobility restrictions. A lot of people were stuck, and telemedicine pretty much was the only opportunity for them to get healthcare. So in the beginning, they were kind of forced into this telemedicine option. But the beauty about telemedicine is that the moment you use it once, it's like magic. It's a magical experience. There's no going back.
I see.
The moment you call in and the doctor can sort out your issue and your labs samples can get picked up without you traveling or waiting anywhere in the comfort of your home in the middle of a movie, and then your results come back to you on your mobile device and you get a call that explains everything, and before you know it, your medicines are at your doorstep, or maybe you need monthly refills to manage a chronic condition and you don't even have to think about it. Somebody calls, figures out where you are, schedules your delivery. I think the moment people have that experience, they're just not going back to what it used to be. So a lot of people were able to get on board as first-time users and have really stuck with using telemedicine thereafter. And in terms of what that impact was on our business, we saw a 650% increase in revenue when you look at 2019 versus 2020. So a huge boost in the number of users. Our users were growing at 150% every month throughout 2020. So growth in users, growth in revenue, but then also that comes with its own kind of growth pains, right? Just between March and April alone, when the lockdowns were instituted, our traffic multiplied by instantly, 5x. And what that meant is that we had to immediately start hiring more doctors. We had to immediately boost our inventory. Fortunately, also, some insurance companies had just signed before the pandemic. Those who were sitting on the fence signed immediately after. And also that also brought a lot of new clients to our door. So the cash flow pressure was huge. We had to make sure that we could beef up all those different areas to maintain the quality of service that we're being on.
I see. I see. One of the again, I read this on your Twitter a while back. You mentioned something about what you consider to be unethical, sort of an unethical move that an insurance company, I think, pulled or something. I don't know if you're comfortable talking about that.
Oh well, yeah. So in all these kind of business negotiations as the startup, trying to do deals with incumbents, you always come off as the David, and they always come off as the Goliath,
Yeah,
right?
true.
Well, the Goliath will also try to scare you with the size of their sword and other things, and all you have are these small
Big
pebbles,
stones, yeah.
right? And sometimes to negotiate peace, you show them the size of your pebbles, and they show you the size of the sword, and like, you don't have to fight each other. How can we do business together, right? But then sometimes it's unfortunate that some business leaders do not act ethically, even when you have legal instruments in place like non-disclosure agreements, and it defeats the purpose of having those instruments when someone can still take all the information that you disclose and try to build a copycat business model. But we're not really bothered by it because we know the work that it actually takes. We know a lot of incumbents are like big ships. It's extremely difficult for them to pivot or to integrate totally new ways, especially if they're highly driven by technology and other operational aspects into their existing model, because that's what they try to do. They try to cram it into the existing model. And what happens also, because our business is entirely different from convention, what happens is that if the consumers like the new kind of business model you've introduced as an incumbent, that means it's going to cannibalize your previous model.
True.
And if your previous model is your cash cow, that means you're going to lose your cash cow in favor of this new thing that is more affordable, has leaner margins, right? So on that front, you wonder where their thinking actually is at, rather than collaborating with another entity that is purely built for this kind of thing. And then also the service quality. I think they underestimated what it takes to deliver the level of service quality that we have at Rocket Health. And it became very evident that it's not going to be a core business area for them, and I think that's exactly where they're going to fail.
I see, I see. Yeah, when we look at this from sort of a big picture perspective, isn't this sort of becoming the next big problem? So right now, and because we're just from an election, if you read most of the conversations online about Uganda, for example, it's a sort of a neoliberal perspective, the colonialist versus the African and things like that, and the racial issue, the black man versus the white man. But from my perspective, it looks a lot like the rich man, versus the not so rich man, right? It doesn't matter where, and I feel it's the same in the US or in Uganda. It doesn't matter where you come from. If you're not beyond a certain wealth threshold, you are at the mercy of the guys who have money. If you look at, say, for example, the big tech companies, yeah, not in health specific. If you look at Google, if you look at Facebook, for example, uh, Snapchat, yeah, Amazon, for example, Snapchat, when Snapchat launched their stories feature, yeah, these guys just took it on. I mean, YouTube also, it has taken it a while, but it has also taken it on, and it's no longer a feature that's unique to Snapchat. And that would be the same thing, TMCG would do something. Again, I feel like that's where you want to go eventually. You do something that's very, very consumer based because that's your business basically. As long as you get to the consumer and have to have the TMCG up on my phone, Google is going to release that version. Amazon is going to release a similar version. I know, isn't this, aren't you scared in a way that eventually we end up, what people call capitalism right now is just going to end up into monopolies only. You can't build something original unless you're building it to be taken up by Google eventually.
Well, you've got to ask yourself, how did these big companies emerge in the first place? They also emerged from an environment where they could have been copied or they were actually copied and people tried to compete against them. Uh, and then, somehow they overcame that and they became, the kind of big tech companies that we see today. They also were once small. They were also once under serious threats, existential threats, and somehow they overcame that and became bigger. And it always comes down to, are you building a mission focused company or are you just building a feature? Because if you're just building a feature, anybody can copy that, integrate that, and crush you, invest more dollars in it and things. And I think, as businesses or as underdogs, I think the key thing is about creating something that can't easily be copied or something that can't easily just be bought and added. Things that are priceless that you can't buy with money, and integrating that into the culture of your business or the philosophy of your business. So a very good example is Amazon versus Zappos. Zappos was selling shoes online and apparel online, and were doing an extremely fantastic job at that. And Amazon, tried to buy them out, and they turned down Amazon. And Amazon tried to do the same thing, and they threw a lot of money behind it. But then there are certain things about customer care and quality and excellence, and and then return policies, and because they were just dealing with a single segment, they were more efficient in their distribution and sourcing of items. And big brands like Nike wanted to sell to Zappos better than they wanted to sell to Amazon, that was known for driving down price, which would kind of take away from the quality of the brand, or the perception of the quality of the brand, and things like that. And Zappos just pretty much beat Amazon, left and right in that particular category. And Amazon at some point eventually had to really up their offer again to really buy out Zappos for over $1 billion. So the small guy can win, right? Amazon went to China to try to beat Alibaba while they were still small, and Amazon took them out. Right? Sorry, eBay rather. Yeah,
eBay.
exactly. So there are these stories where depending on if you have certain qualities that provide you defensibility to really help you grow your business. And I think for us, in our business at Pocket Health, it's really about that tight knit integration end to end. Right? It seems easy to think about, but it's extremely complicated in terms of the number of moving parts and how well they all have to fit into each other, knit by technology.
Okay. Yeah, and we're going to move on from here, but just to push back a little bit, I feel like maybe today it's not comparable. So when Google was coming up, right, it had obviously competitors and such, but the internet was also still new. at that point. Internet for end users, for consumers was still very new, for non-many people still very new. But also, they want companies that had the kind of money Google just has as an insurance policy, right? Google has about 140 billion US dollars in cash, sitting there, waiting for the next person who could disrupt Google, right? So that is, you need to be like Einstein to the power Einstein to come up with something, that would totally do. I mean, obviously, over time, as they become bigger companies, then there's no focus, so you can sneak in somewhere, right? I think that's what you probably aim to do as well. But from what I feel, the future, because this is now the model, right? Amazon is doing the same thing, Apple is doing the same thing. Facebook is a very young company. It's doing the same thing as well. It's also holding cash just so it stays alive forever. I feel like in the future, eventually, it's going to happen when there is just no space for creating something you can own. I mean, you can create definitely, and the sort of the ideologies around entrepreneurship are going to change. People will start asking, why you need to own it if Google can own it for you. Yeah, I think that's the conversation that's going to happen. But it's a bit scary that right now the monopoly thing is taking over capitalism.
I think it doesn't limit creativity.
Okay.
You can still express yourself creatively, build a company to help you even make that even more pronounced with a service or product that you then take to market. I think that will always continue. What you seem to be referring to, the way I understand it, is the trajectory of those kind of companies. Are we going to see more acquisition of those companies getting integrated to create even bigger monopolies for some of the big tech companies? Or are some of these companies just going to choose to stay independent and run by the founders and things like that? But several things complicate that decision, right? What was the original intentions of the founders? Was it just to really build a company with a product that serves people, and they just want to keep going and finding new ways to do that better? Some other companies in their trajectory have taken on investors who want an exit, and the way that they exit is if they get acquired by another company that has an interest in their product or their niche or whatever it is, or their staff, maybe because of their expertise. And acquisition offers are very welcome. And some founders also maybe get tired. And when an offer is on the table, they're like, maybe this is my time to go out. Or you reach a point where you cannot fundraise for the business any more than you already have, and the only way you can get further with your mission is if you have the kind of resources that Google has. So there are all kinds of factors that kind of play into that may not necessarily be about big tech just dominating and trying to be a monopoly.
And the reason I'm bringing this up, by the way, is the fact that these companies have few decision makers, right? When you look at companies like Facebook, few ultimate decision makers, there's a very small circle they call the board, right? That actually makes a lot of the significant decisions, depending on what direction, say Facebook or Google will take, right? And why I want to bring this up is this is coming to help, right? One of the controversies that I've read about was that Bill Gates' sort of persuasion for the vaccine, for the corona vaccine to be more commercial rather than open source, right? Sort of dissuading, using his financial muscle to dissuade, I think, the lab in MIT. I read this article, and I'm pretty sure it's accurate. So if you're not familiar with it, it's not fake news on the podcast. Yeah. So Bill Gates through his foundation, definitely. I'm saying Bill Gates, but I mean the Bill and Melinda Foundation. They persuaded the lab at MIT to, instead of open sourcing their work on the corona vaccine, to instead sell it to, I forget which one it is. I don't know if it's Pfizer, but to one of those big farmers, right? Because the farmer had the money and the distribution means to move the vaccine more efficiently than if it were open source, yeah, and also to manage the regulation. So regulation again in medicine is a big thing, right? But if we get to that place where these rich guys can start pulling such big moves under the table, no one knows this, but the reason the vaccine is not free is because Bill Gates already has a lot of money, and that money can influence some of his major decisions, right? Isn't that don't we reach to a place where we start to look at these guys like real Alex Luthor, like real scary super villains, people who have superpowers, but they actually may have intentions that are not the most popular intentions.
Let me see, where do I start with this one? So let's see. So first, people need to understand the process of bringing a vaccine or a drug to market, right? Just for context, a blockbuster drug or a drug that is popularly needed around the world, or that is you could say a new kind of invention, costs about $1 billion and 10 years of research to bring to market. And as a result of that, they get a 20-year patent so that they can be the only ones to sell and market that unique, formulation in the market. So that they can be able to recover that investment and also make a profit. Because if they don't recover that, if there's no patent, there will be no incentive for somebody to invest $1 billion and 10 years of scientific research to arrive at that blockbuster drug that's going to save billions of people. Same thing for vaccines. A lot of work around vaccines is going on in labs, even right now, about viruses we probably don't even know about yet. But a lot of that work is funded by foundations because it advances science. And a lot of these are research labs that may be found within universities, funded by charities and donations. And the way these universities also really, make their money, and also the way scientists also value their work, is by getting patents and that they can eventually license out, and that's how the universities are able to generate revenue to maintain their to maintain their activities. But then that's also how foundations also will replenish resources that they invested so that they can even do more good. So when you see guys like Pfizer or Moderna or whatever holding onto these patents, it's because there's probably a background of billions of dollars and years of research and patents that were filed even before coronavirus happened that are now all of a sudden extremely relevant, right? A lot of this work around, people think the coronavirus vaccine just emerged in the last 1 year, but actually there was already pre-existing work from the days of SARS, right, and MERS and all those other things that are that just got fast tracked because it became important. So there are all these kind of research studies that are going on that we don't know about, that are probably even just seated in a fridge somewhere at minus 80 degrees until there's enough funding or until there's a crisis, so they can just there's funding resources that can advance that one. Yeah. It's
No,
not,
I think actually I get that clearer. So what you're saying,
and I think there's nobody that has been more pro vaccines than Bill Gates.
Yeah,
He's
no,
invested
true,
a whole lot of his personal resources.
that's why this surprised me. So yeah, I think I see that perspective. So you're saying the incentive again has to, if we start,
If we stifle the whole patent agreement and licensing and things like that, then you're inevitably stifling innovation and investment in research.
Okay, I see. All right, I will go and do that again and call you back on another podcast. Okay. So let's talk about the corona thing. Yeah, and I've been reading multiple versions of people. Not most. A few people are saying we have overreacted, right? And some people have been comparing numbers for coronavirus versus numbers for the common flu. How many people get sick and the rate at which which people among those who get sick die, and also the rate at which the demographics of which say how many children are actually killed by the common flu versus how many children are killed by coronavirus, and versus how many old people are killed by the common flu, for example. Yeah. And again, people are saying, this is getting more attention than, say, the HIV pandemic, right? And it's, there's all that. Are people overreacting to corona, in your opinion? Or do you think this is underreacting? Or do you think this is just the reasonable amount of reaction?
Like, if you look at the number of deaths, which I think is over 1 million across the world in the span of time, I mean, it would scare anybody, right? Some of these other diseases, we've kind of figured them out. Science has worked out the details. At least we know the enemy. In this case, it was scary because we didn't know the enemy, and the enemy was manifesting differently in different people of different ages, of different regions. It was just a scientific black hole. And I think that's exactly what made it scary. And also the fact that it was airborne also made it extremely scary. The fact that people didn't know how it interacted with different people of nutritional status, of age, of right. I think all those, how are we safe in the hospital? Should we continue doing surgeries? Like, what are the long term effects of this thing? I think it is more the the, the lack of information that was more scary than anything else.
I
And
see.
I think that was reason for people to just take the most precautious means necessary.
I see, I see, I see, I see. Yeah, so that also brings me to uh, the politicization, politics part of it, and we are going to look at, in the U.S. they have their issues about, how you signal how liberal you are by wearing a mask appropriately, and how you signal how
Conservative.
how conservative you are by choosing to retain your right to not wear a mask. But in Uganda, uh, we've seen the government use this as a major excuse to, do things that we read about in 18 Reasons for the Fall of Idi Amin, to do things that I honestly thought were behind us, right?
Yeah.
And again, Corona has been used as a very clear scapegoat. We've not had any sort of independent scientists, Ugandan scientists, who have come out to make clear statements, so for example, right, when you see Corona being used as an excuse to block rallying, while again, indiscriminate rallying, right? Some parties can rally, others cannot. And which is, again, politically, you'd expect if you're versing the state, the political situation in Uganda, that is not very surprising, right? But my worry is we didn't have doctors, we didn't have you, for example, write for us a paper, publish for us a paper we can discuss on a podcast here and say, it's okay not to rally or it's okay to rally, whatever. I mean, it happened in the US as well, where people are saying you can't meet until the Black Lives Matter movement started, and then we're like, you know what, I think it's okay if it's a racial thing. What is, how do you feel? How real does this feel to you with this kind of politicization? And again, that also falls back to the question of, are we overreacting, because of ulterior motives? Is the US overreacting because they want to overthrow? I don't know. Is Uganda overreacting because they want to keep Bobby Wine down? Or is this Corona thing a real problem we should be worried about?
I think the long and short of it is that the moment politics versus science starts to lead how we manage public health, it always becomes messy because somebody will always have an agenda. Somebody will always want to take advantage of the status quo to drive their own end. And yeah, the moment you go down that road, it's no longer about saving lives. It becomes about something else. And the moment it becomes about that other thing, we lose focus. We cease to focus on the main thing. And it hurts us more than anything else. So SOPs are great. Just apply them uniformly. Right? The one thing that we try to promote in healthcare is equity. And if you're not equitably applying these rules and principles, there's going to be an issue. Right? If you can't achieve that. So it's sad, seeing people donate money to make sure that we have more masks, more sanitizer, more oxygen in hospitals, and some people prefer to buy double cabins. I don't know. It's a question of priorities and leadership, and trying to keep politics out of public health and just focusing on the science and communicating the science. And I think doctors and leadership amongst doctors hasn't trained them very well to confront people that approach public health politically. I think there's a very non-confrontational stance by medical professionals that may need to be thought about, and maybe some new kind of training needs to emerge, or leadership needs to emerge, where the science leads and not the politics.
Yeah, one of the data controversies that just come back to my mind was I looked at some data from the US, and this may be scary. I don't know how familiar you are with it, and it shows that most of the people who are pre-put on ventilators when they got affected actually end up getting hurt by the artificial ventilators, right? And the guy was trying to make an argument for why sub-Saharan Africa did not get a big hit. And he's saying the fact that most of the people who got infected in sub-Saharan Africa didn't have access to ventilators could have actually been the reason for their lives to be saved. And I don't know if you're familiar with this medically, but apparently the way, I don't want to get into the technical stuff, but the way the lungs work and the effect of using those ventilators on lungs that actually don't need them yet would actually mess them up a little bit more than, and I don't know if you...
Yeah, I mean, in healthcare systems where a lot of this equipment is readily available, chances are at the signs of respiratory distress, you could get on a ventilator as an option if it is required to make sure that your oxygen levels get back to what they should be. And it's a very effective way of being able to do that. And that is why there was a huge discussion around ventilators, in the developed countries when they talked about COVID-19. When you come to our setting, ventilators are only seen in ICUs, and those are very few. And so ventilators were not really an option for us. And the process of ventilation is not an easy medical procedure, right? Because somebody has to what they call intubate. There's something that they'll have to use to hold your tongue back and make sure that you get the timing of the tube right and slot it in without causing any injury to surrounding areas. And eventually, it's not an easy thing to practice and learn to do. And the people that are best at doing this procedure, it's normally for anesthesia more than anything else. And trying to make sure that all general practitioners at whichever level, or even other clinical candidates can know how to do this at scale is quite difficult. So that not being an option for us, I think meant that we had to prioritize who eventually gets on a ventilator. So I think whereas other countries may have had that option and may have seen a whole lot more intubations done, chances are that there was also a whole lot more injury done during intubation because of the scale that it needed to be done. So I wouldn't call it a cause and effect kind of thing, but it's just more about context and resources.
Again, while we conclude about the virus, rather about the vaccine and the medication around it. Uganda has procured some vaccines, or is procuring some vaccine. These things are very funny. You don't know what's going on. But there's a story about vaccines getting procured, and there's Uganda somewhere in the background. But also, Uganda is manufacturing, apparently, designing and manufacturing its own therapeutic, like its own medicine. Yeah. How much trust do you have in this? Before you actually answer, I'll give you a history. Before the white man comes, we were able to do the C-section. We didn't call it C-section, but Uganda were able to do that. We had the significant line of herbs and what we call gods, but which was sort of medicine-ish, to cure some of the most common ailments, right?
Yes.
So it's not that we are inept. We definitely have and now we have people like you, you also picked up on the white people's tricks, and you add to ours. Now How realistic is it that we can manufacture, we can design and manufacture a corona therapeutic, because of the leading edge, there is nothing in the world right now that is at that place yet. How can we be pioneers in this thing?
So I don't know how much you have read about the science of what Uganda is trying to do.
I haven't.
Okay. So we're not manufacturing a drug.
Okay.
What we are actually doing is we're getting the plasma of people that were previously infected that has antibodies and trying to get that into people that have COVID-19 and have not been able to elicit sufficient immune response to kind of beef up that immune response. That's exactly what we're trying to do. So basically, it's just taking...
I see. Okay.
Taking antibodies from people that are infected and putting those in people that don't have a good immune response, so we can beef that up. So that has already also been used in many other areas. It's been used in Ebola outbreaks before. It's been seen to be somewhat effective. So we'll wait and see what the results of those studies, eventually do look like in our particular context. But then also the source of all pharmaceutical medicine, modern pharmaceutical medicine, so it's still really in nature. It is mostly nature. It's us trying to identify the elements that exist in nature and us trying to replicate those in a lab and finding ways that we can mass produce those chemical compounds or discover new chemical compounds using all kinds of computer science and bioinformatics now, and find the right combinations for the right disease causative agents, and introduce that as new medicines to the market.
Yeah. Two questions. How does this scale? That procedure you mentioned. It looks to me like it's not uneasy to scale procedure. And also, if it's scalable, why isn't why are the Chinese doing it?
Exactly. So it has been tried in other developed countries.
I see.
But then the results so far in some of those countries are mixed results. In some instances it works, in some instances it doesn't work. It can't be used as a definitive scalable solution, which is why the vaccine is extremely important.
And also, aren't you worried that, again, you mentioned also, 10 years of designing a vaccine, a couple of years of testing the vaccine, clinical trials, a couple of billions, $1 billion to actually get it to a place where it's even feasible for clinical trials on humans, right? But right now we have a pandemic, and Bill Gates is waking up the next day and telling us, by the end of the year you'll have a vaccine. How can you trust a vaccine that has been rushed through that kind of process?
So what's important for people to know is that the vaccine has gone through all the processes. Only that it has been prioritized versus any other kind of approvals. So normally there's a queue, right?
Okay.
So it's not because vaccines taking a long time. It's not because the science isn't ready. It's because there's a queue of approvals that needs to be done. There's several other. So what basically happened in this instance is that it just got bumped up the list.
What about the issue of side effects? Because then I imagine some side effects show up after 3 years or something.
Well, we don't know 3 years because we haven't lived that yet, right?
That's something about.
But I think like anything else, right? There are some things you only understand when it's in several different kinds of people, right? Vaccines have known to cause certain side effects in just a small portion of people, right? So even if it's less than in 3% or 2% of people that get maybe a fever, or maybe they have an allergy that they didn't know about, that and the allergen was part of the vaccine. Some of these things only really get figured out at scale and over time. And of course, because clinical trials haven't been done in several different countries, you can't know what unique aspects in different regions and races and what can really have with any vaccine or even any drug that you bring, with anything in the medical field actually. So that's why things like what they call pharmacovigilance, right? A new drug is brought to the market, it has been tested in humans, everything has been approved, but we still need to monitor if there are any new scenarios or drug-drug interactions or hub-drug interactions that we didn't know about that eventually emerge further down the line. This is also one of the reasons why things like genetic studies are extremely important, so that we can be able to build profiles of the kind of genetic composition, let's say, of Africans on the continent, so that we can also make those databases part of scientific research and clinical research and so on.
Yeah, from what I'm picking from this conversation, you're saying I should persuade from 7 take the vaccine for me too.
No, I'd encourage everybody to take the vaccine. There's no reason for anybody to be afraid of it.
Polio, I was vaccinated from polio, right? But recently, I think last year 2019 rather, the polio vaccine it backfired in Sudan. Is it Sudan or South Sudan? One of those two countries, right? And it was the rate at which the kids who actually immunized got infected by polio because of the vaccine was 80%. 80% of the people, right? So if a vaccine like that I took, more than 2 decades back, if that can also, if the scientists can still make mistakes there, how about this one that's been rushed? And again, that's the worry.
So it's also about the knowledge people have around vaccines, right? What is a vaccine? Vaccine is a weakened version, or a safe and weakened version of the actual thing, actual virus. And it's introduced into your body so that your body can learn how to identify it and produce antibodies and immune response to it. So that next time it sees the actual virus, you already have the defenses, you already have the silver bullets necessary to kill this thing off. Now, the important thing around vaccines is that there's a chain of custody that must be strictly adhered to, or else this weakened version of your virus can become the actual thing. And largely these involve temperature controls. So, between -2 degrees and 7 degrees centigrade. And, once it's taken out of the fridge, there's a very defined time within which you must expend this entire thing. And never should it be, sent back into the fridge, right? Unless it has been maintained entirely through those temperature ranges. So the moment you have had to reach areas like Sudan and South Sudan, and you have these vaccines traveling over long distances, and maybe the equipment that is used to store the vaccine is not properly maintained, or even the temperature isn't regulated and tracked, because that's what has to happen in real time. And if at all it goes out of those ranges, then you have to, or over a certain number of hours, dispose of those vaccines. If that isn't happening, if people aren't properly trained, that's how you end up with those kind of scenarios causing negative effects.
Yeah, it was most likely a management issue.
So no, exactly. So it's never really about the vaccine or the manufacturer. It's really about maintaining that chain of custody to the end beneficiary.
Let's go back now to GMC and thingy corona. So again, Uganda has a terrible health sector, right? And I'm wondering, you're now looking for big money. You're looking for. I read some of the stuff and I saw the numbers. I was like, this has to be my friend. You're now looking for big money, but where is that compromise going to be between meeting people who need the service versus meeting people who can afford to pay for a service that makes you rich? Where do you think that line is going to be drawn between can we serve all the Karamajongs, right? For a small tiny margin, small fee, or can we serve the people in Kampala and Wakiso and make 10 times as much money? For you, how do you see this approach going?
I think for us it comes down to our values as a business, as a Medical Concierge Group. Our values are centered around making healthcare as accessible as possible. Right? We want to balance access with commercial viability. We want to provide as much access as we possibly can in a commercially viable and sustainable model. Right? So right now, whereas the people in Kampala may use the insurance to get the service, and we have to pay a good rate to the insurance companies and we make margins off that as a business, somebody in Karamoja may not be able to afford that. But then also what's happening within the setup of our healthcare is that you have development agencies, you have clinical research institutions, and what they do is that they get into a contract with us and provide us the resources to provide our services to these end beneficiaries at no expense of the end beneficiary. So in that way, we're able to make telemedicine available in hard-to-reach areas amongst vulnerable groups, and they get the same quality of care as anybody else with insurance in Kampala would be able to get. Where we need to be able to get to as a country is where we have a national health insurance scheme where the people with means are able to take care of the people that don't have the means. The people that are healthy are able to subsidize care for the people that are not healthy. And that's how we'll achieve equity in healthcare services. And we hope that we have a national health insurance scheme. It's taken forever for us to be able to get it. We hope that telemedicine would be a service under that, which would mean that automatically everybody in the country would have access to local health services.
And how realistic is that? I know even in developed countries like the US, it's still not.
So, it made its way into parliament.
Oh, I see.
And it got a certificate of financial approval. And then right before the election period, somehow it got delayed or thrown out of parliament. I'm not too sure where exactly it is, but there's a lot of negotiations around it across many stakeholders to be able to bring this back. It's taken about 10 years of discussing and negotiating and revising and revamping this thing. And, we hope that, at some point in the near future, it becomes a reality. Many other countries already have it. Kenya already has a national health insurance fund. Many countries across Africa do. Rwanda also has the Mutual Sante. It's common practice in many countries.
I see. And how realistic is it to take the private approach to this? I imagine, for example, like MCG, you charge me, say, twice or you charge you start something equivalent to insurance, right? And you say, our insurance is slightly more expensive than normal insurance, but the excess money we use it to take care of so and so and so matter. How realistic is that?
I wouldn't bet on it,
The
but
competition would kick it out.
because even what we call middle class in Uganda still is a very tight description in terms of how they live their lives from day to day, from paycheck to paycheck, and a lot of people don't have extra disposable income to take care of the healthcare needs of somebody else. So normally it's just enough for themselves, and we need to get to a point where Ugandans can generate more income per household, and hopefully, with those economic initiatives, be able to increase their purchasing power for healthcare services.
I see. So you have the major part of your business model is the accessibility feature, right? I sit at home, I get served from home, right? How do you see, in terms of investment, like going in the future, say you've got Bill Gates, you've got into Bill Gates places, and then you've got like real other business interests, people who are giving you money to make a profit. You've got those people balanced well enough, and you have a little bit of finance to see this. What are those key points where you feel like, this is a good place to invest? Say you have a budget of say 100 million to invest in a year. I mean, that's not realistic. $100 million, but say you have a significant, I don't know how much money is by the way. So I'm throwing around these numbers because they sound good in my head. But you have a significant amount of money you can spend in a year, right? And you're doing good business. So because the service again is really good, so you're doing good business. So you're not worried that this is not sustainable. What are those key points where you think this is where I would invest the money, this is where I would invest the money, this is where I would invest the money?
So the way that I see it, one, we need to be able to drive down the cost of care and make it as accessible as possible, and be able to engage professionals in the delivery of services by providing quality health care, and being able to identify all the efficiencies that we possibly can using technology, right? So just to give you an example, we are trying to get to a height of scale where we have a technology platform that a doctor can join and immediately start providing consultations to patients, regardless of where the doctor is and regardless of where the patient is. And if that doctor requires a lab test to be done with this patient, that the doctor can make that lab request within that technology platform, and another professional, a lab technician, regardless of where they are close to the patient, they can be able to pick up that sample from that patient, take it to a partner lab also that's on that platform, run that test, have those results into this platform. The doctor can see them, the doctor can write a prescription within that platform, and guess what? Another independent pharmacy technician on that platform can pick that up from an independent pharmacy and deliver it to the patient. What you have really done there is created a network of professionals and providers on a technology platform that will make it immediately accessible to everybody. It won't matter where you are. It won't matter who's giving you the care. It will not be about brands anymore. It will just be about that platform that just makes it all work together. And think about that, in terms of vaccinations. Think about that in terms of all kinds of care that you could possibly need, coordinated by a technology platform. I think that's what is possible when you look at the height of scale for us as a business. In terms of reducing costs, right? If you think about if you could import and source these medicines yourself, right? A lot of money gets lost in middlemen and distributors, and a lot of margin gets added by middlemen and distributors. You can reduce, if you have that level of skill that I've just described, and you're importing your own lab reagents, you're importing your own medicines, you can really reduce the cost of care. If care now ceases to be about setting up a hospital and a clinic and whatever, and it becomes about people just joining a technology platform, it becomes immediately cheap. All the money that gets invested in these high-end locations and real estate and all that stuff is now savings to the end beneficiary.
Oh, I see. Yeah, that's it feels like everyone who's joining tech is looking at an outlook that's very similar to that. So I think, if I get it clearly, right now, say on iTunes, if I'm a music maker, I go to iTunes, I sign up, Should we get another bottle?
No, it's okay.
I go to iTunes, I sign up, I put my music, right?
Yeah.
And then another random guy comes, he curates into a playlist that you can distribute, and then you come and you consume.
Exactly.
I see. Yeah,
So-
that's
Yeah, so I feel like it decentralizes healthcare, democratizes healthcare, it digitizes healthcare, all the kind of ingredients that you need for healthcare to really become exponential.
yeah. And in terms of infrastructure, how feasible is this? In a country where I know we have phone penetration that's
Yeah.
significant, but sort of smartphone penetration that would sort of have even mild, like technology that can support a good, well-managed ecosystem. Is not that penetrated, right? How do you maybe have any predictions on where this is?
What is interesting is that you can actually do this with off-internet technology. USSD is a very good example. We're going to be launching something very soon.
Okay.
And what that will mean is that even just with a USSD short code, you can be able to access all these different services. Right? You can request a callback from a medical doctor or from the lab. Right? So everything can also happen offline. So for those people that are comfortable doing that same offline, we'll also be we'll be able to do that, and those that are comfortable doing it online. So I think for us, it's been part of our philosophy that everything that we create for online, we must find a way to be able to deliver an option offline.
And is this a Ugandan thing, or are you looking at? I know that at least when I was at TMCG, there was TMCG in Nigeria and in Kenya, right? And are you sort of looking at a place where you start to move these, to sort of scale these in parallel?
Definitely.
Oh, okay.
Definitely. So I feel Uganda is a great place to pilot and do early rollout, see what early adoption looks like. I think the cost of bringing something to market is lower in Uganda than anywhere else, and yet the commercial opportunities are larger everywhere else versus the scale of Uganda. So I think everything that we take and works here is something that we're also optimizing to work everywhere else. So Uganda has a largest scale operation. What we have done in Kenya and Nigeria is more like consulting, but still within the areas of telemedicine. And I think we're about ready to now start transplanting the setup that we have in Uganda into.
Okay. In terms again of the other part of the investments, I know most of the investors are looking to make money off the investment, right?
Yeah.
But then there are the do good guys, the guys who invest specifically to make an impact, right?
Yeah.
What happened recently was the president ordered the closure of DFG.
DG.
I didn't even know that it existed, but
It's one of the largest donors in the civil society.
Yeah. So what does this mean to sort of your approach to business? If donors become a threat to even, I imagine DGF had some donations it made that impacted health directly, right? If such donors are at the mercy of this one guy, what does that? How does that?
It comes back to that investor confidence thing we talked about. The same thing goes for donor confidence. A lot of healthcare is supported by donors. The entire Uganda blood transfusion bank is supported by donor funding. And without it, pretty much blood transfusion breaks down. And that's a critical part of healthcare, right? If you look at the USAID and its contribution to HIV treatment across the entire country, right? Without that, a lot of people will not be able to get the antiretroviral medication. So there are very tightly integrated aspects of donor funding into how we experience healthcare, and maintaining, ideal and optimized donor relations is extremely important, considering that we can't afford the entirety of our healthcare budget by ourselves. So, definitely recommend, caution and dialogue with these things, and, not any erratic decisions, because the effects could be far-reaching.
So I think that covers the biggest part of the conversation that we've had to have with you on the business and how you see the future. Now to go back to the past. This Davis guy at university or before university, before you start getting all these big ideas of disrupting our health system. Who is Davis at that point?
Oh my goodness. I'm not sure I even remember. Maybe I'm even thankful I forget.
You're the head prefect in secondary school.
Well, I went through primary schools just like everyone else, public schools. Everyone pretty much went to public schools at about that time. Made it into St. Mary's Kisubi. Met a bunch of really smart guys there. You think you're coming from these town schools, and met some really other brilliant people from much humbler backgrounds than you could have imagined growing up. And you really do get challenged to be a better person, to be smart at whatever it is you do. And I think it was a great place to learn some unique Christian camaraderie, solidarity values at that point in time. And then further ahead, went in and challenged myself to shift to another school that also had a different kind of context, King's College, and just to be able to broaden my network, or just experience new challenges and new contexts, and found my way into university. But I think going through that, I was always the quiet, awkward kid. Nerdy in many ways, but then also I like to take on sports. I played rugby throughout my high school years. I still love to watch rugby today, and it really gave me a good set of friends and values that I still carry with me today. So whether it's teamwork, persistence, hard training. You may not looking at my size right now, but back then when we were kids, we were all the same size, right?
I imagine as a rugby guy, you were slightly of the other.
I was not the strongest, I was not the fastest, but I was one of the trickiest.
Oh, I
right?
see.
I could steal balls, I could do things like that.
Oh, I see. And the thing that I know for sure, growing up again in this country, or I think growing up anywhere, is there's the pre-confidence, like say after school, or when I was in A level, for example, I met a lot of people from King's College who are in the for level, right? And they come with a different kind of confidence. And some of these guys, okay, they had money. Money is just another factor, but it wasn't even the money. The way they talk to the girls, were things for people like I came from a single school, also, so that's the weird thing. I came from Medical College, and that to cover up for, but still, it was at that point it was impressive to me, right? And how does this kind of the confidence, or I don't know if it's a confidence because of the reputation, or if this is like intentionally instilled within the school, the sort of a confidence and the way you take yourself as a Goliath, or as a Ngonian, or as a guy from Kisubi,
I think every school comes with its culture, right? Good or bad, whatever fuels it. And some values are great, and you want to kind of embody those and take those with you. Whether it's confidence, whether it's hard work and persistence, whether it's humility and respecting people. I think each of these schools has ways that they inculcate these things in you. Either because that's just the culture in the school, or that's just the people that it attracts that have these values. But regardless, one way or the other, they rub it. And I think that's a big thing. And some people it's misplaced confidence, right? Or it's confidence rooted in the wrong things, and then life teaches you a few more lessons further down the road. But we need to find those good values and carry those with us.
Yeah, I know. Actually, now that I remember, there was I think a year back, there was a big conversation about how the guys, how you the men in Budo mistreated the
I was only there for 2 years. They have this whole saying that when you go to Rome, act like the Romans. But in that regard, there was a lot of negative attitude towards how they treated different genders within the school. And for us, it was a shock coming from a single school, seeing some of these things happen, because we had learned to hold women in awe and put them on a pedestal and treat them like ladies, try to vibe them, make them comfortable, try to impress them, and all these other things. And then it's the complete opposite. And like I said, you get to choose what's good and you leave what's bad. So everybody has to make that personal choice, how they choose to live. And hopefully that culture, also gets changed by the people that lead the school and the people that they let in and the people that they actually exit because of that behavior.
And I know it's not just Budo by do you imagine that this is a side effect of the actual school administration, the style of administration, or is this, the school selected for just terrible people?
Yeah, I think there's some people, or could be staff leadership, who, that enable that behavior, or they don't, by either not punishing it, or
Yeah.
even the way that the school was structured, because the school was initially structured as a boys' school, so it has a lot of that historical structure that still favors some genders over others. That would need complete restructure in that way. So yeah, I would say there are several factors that have built up over years that have enabled that behavior.
And how does this also? I know when you go to such school, I mean, I said that my school as well is at that, yeah. But when you go to when I was in primary school, for example, I was in Virginia, yeah, and when I was there, it was sort of a given that you have to advance to King's College Budo, right? Yeah, exactly. Yeah, so and everyone actually, I remember when we were doing our choices for secondary school, it was like it wasn't a thought, King's
Number
College
one
Budo, and
choice.
then you think about what
Everyone
high schools
else.
do you actually want to go to, things like that. When it comes to coming from a background where you've been around some of the most successful, because of also Abudo, SMAC, all these schools, they produce some of the most successful actually Ugandans. Right? When it comes to coming into employment or coming to, for example, business as you're doing right now, and this is your network, right? If you go for, say, Bodonian parties, I don't know if you guys do reunions or something like that, you go for. Okay, I mean, but you still go for, when you're having a
Smack league, for instance.
exactly, yeah, you
Right.
do things like that, if you have that within your social circles as, a grown adult, what is the impact of that?
I think it's definitely very helpful because normally this is a very ambitious group, it's a very smart group, largely, and they will inevitably find themselves in positions of authority, of power, of impact, and just finding people in the right places. Just this week, we're involved in a project. It's a multi-million-dollar funded project, and they recently had a data analyst, their lead data analyst, and because we are doing the work in digital health on this project, they sent him over to us, and he turned out to be my former classmate. So it made the whole conversation much easier, right? Because we had a background, a personality background, a cultural background, a value background that we could resonate with, that could get us through whatever it is that we needed to discuss. So things like that can be quite interesting. Yeah, or you knock on a door and you find somebody that you know who knew you. Maybe it was somebody junior, and then they're looking up to you, and they know who you are from way back and not who you pretend to be now, right?
Exactly,
so things like that could be quite interesting.
And what was people here never share, I think, stories from like high school. Most of, including myself, we try to blur them out. But if you were to judge, high school, that the experience in school, secondary school, not just HSC, but all of secondary school, and the experience, for example, you'd want your child to have, what are those things that you think, definitely this was just stupid, like I think prep time. For me personally, I think, if I become president, I just instead of I call back BDF and like.
I beg to disagree, but go ahead.
So things like that. I think some things in school, and again, I've actually done some research about the impact of sleep to your intelligence and your intellect and things like that. And I went to a Catholic school, so maybe that was inevitable, but also the whole religious thing. That I also throw away a little bit. There are a few things that few experiences that I had in school. If they had instead of Christianity, instead of the religious part, right? If they had emphasized more socializing, if you had instead spent more weekends going to visit girls' schools, I think that would have made me a far better person than I am, right? And right now it's laughable, but when you grow up, these are the important things. When you grow up, you reach a point where the money is fine, okay, you've learned maybe enough chemistry to work in a lab or something, but now the social skills, how do you...
That's important, definitely is important. Being able to build a social network across classes and across schools. I think that's probably one of the most valuable things you can take out of that high school experience. I would say the second thing would be discipline, because I think that's a very formative age that discipline either gets mastered or gets lost. And sometimes I would think some of those routines like prep or waking up early or going meals on times on shift, or I think all those things, yeah, we may look at them as being cumbersome, but I also think that they were meant to instill discipline.
Yeah,
and also when you think about how much Catholic schools would insist on attending church service once a week and then also on Sunday, I also think those were more opportunities for the chaplain to talk about values and life and, giving you a reference of Christian teachings, but really what they're trying to do is to inculcate certain values, I would think. And also just giving you a different experience from just purely academia, because out of that experience, some people are finding their calling, right? Some people in my year have gone on to become fathers in the Catholic Church in Italy and have gotten PhDs sponsored by the Catholic Church as a result of that Catholic upbringing. So, it may not be for you, but it may be for someone else, right? Same thing with sport. There are certain schools that inculcate sport even more than academia. And those schools have produced world-class athletes. And that is fine. So I think it's really about finding that optimal mix within the school that eventually provides everybody a career path and the discipline and the social network that they need.
Yeah, and also maybe the one thing that for me was fascinating in school that, now I reflect back on and I see this could be a big opportunity to make different to produce a different person coming out of the school is the relationship we had with the teachers, right?
Yeah.
Where I was in Ginger College, for example, it was quite distant. Even the guy, I think we had a career guidance guy, a counselor, some sort of guy. Apparently, the guy you go to when you have problems. But he was probably the most distant teacher you could. There's no teacher. You couldn't crack a joke with teachers. It was very the hierarchy was clear. This guy is a teacher, a student. When you're not in this class, the boundaries are there. But now I realize, like, for example, I go back to Linda College for fundraising things and stuff like that. And because, if I go right, it might be tough to think out a lot of money, right? and they sort of now start to treat you in that kind of, I know the word exactly, but it sort of even guilts me. This guy,
treatment.
This guy would have been my friend if he wanted to. He had all the power. To create that friendship, to create that friendship, and that's I don't know, isn't that something they should be enforcing in schools? Or
I think so, definitely, right? The relationship between the student and teacher is critical to the performance of the student, and sometimes that relationship saves students from failure, bad behavior. Maybe we just haven't had a culture of people learning how to build relationships with young people. But now that we are a predominantly young country, I think it's getting better because association, socialization is more important to young people. And I think maybe we recognize it more now than back then. So, same thing with medical school. The only way you get better is if you have a better relationship with the doctor that's teaching you all these techniques. If that relationship is broken down and hierarchical and patronizing and whatever, the student almost always never learns. And, of course, in the medical practice, it's very prevalent that some senior doctors are out of touch. And then again, I think it's also a generational thing. It's probably very different right now with the crop of senior doctors that we have that emerged out of my generation.
And when it comes to what you end up doing after school and all that, at what point in your maybe school or before school or after school, at what point do you see yourself being this person? I know going to Google definitely means you must have been a black belt. That's a signal. Yeah, so you're good at the biology stuff and all that stuff, but at what point do you say, you could have been an engineer probably, you could have been any of those other things, right? Why do you zero down on health, and why is it when you go to health, you choose to sort of take the approach you're taking towards health instead of being like a
so I read Ben Carson's book when I was 12. And I think like any other kid that reads Ben Carson's book, you want to be a neurosurgeon. And then I started looking for all the surgery books in the school library, which was fortunately a very well-stocked library, and I found some. And I think for me, I've always just been fascinated by the science of medical knowledge, the body and how it works and how intricate it is at a very small level of detail, and how it all just breaks down when it's not working, and how it really works when it comes together. I think for me it was always just a fascination. I was probably more fascinated with medicine than I was about becoming a doctor.
Oh, I see.
And when I realized why being a doctor is not such a great experience in this country, I think that kind of motivated me to create a system that makes the experience of every other doctor that comes after me much better than what I had seen. Yeah.
Okay, that's I think Davis, this is it. This is the conversation. This was quite in depth, and I enjoyed it very much.
The pleasure is mine too.
Yeah, thank you very much for accepting our invite. This has been
Anytime.